Adapted for radio by Ray Cooney from the original novel by Richard Gordon, it stars Richard Briers as Simon Sparrow and Geoffrey Sumner as Sir Lancelot Spratt. Episode 3, Anatomy.
I mean, it's jolly decent of Tony to let us share his flat, but I must say, I find it a bit awkward.
Oh, you'll get used to it, Simon. Oh, lucky old Benskin. Wish I had a smashing girl like Vera in the flat opposite to bring me breakfast in bed each morning.
Yeah. Tony certainly got it all laid on, if you know what I mean. So, mind you, it was a bit difficult this morning, you know. I mean, I was in the bath and I'd forgotten all about Vera. She barged straight in.
Oh, what did you do?
Well, I covered myself with a loofah. Yeah, Vera laughed too. She said we could walk into her flat any time she was having a bath.
Oh, well, that's jolly decent of her. 1 or 2.
Huh?
Lumps.
What?
Of sugar in your coffee.
Oh, yes, thanks, yes.
Yeah, what's the time?
Nearly 10 o'clock.
Is it? Oh, we're all right, I suppose. Don't have to be at the hospital till 10:30.
No.
Still don't want to be late first day, though. Anatomy. Just think, by the end of this term, we'll know everything there is to know about anatomy.
No, we certainly will with Vera wandering around the house.
Morning, Simon, Taff.
Morning.
Aren't you dressed yet?
Well, we're not going anywhere, are we?
First day of anatomy.
No, I'll skip that. Any coffee left in the pot?
Oh, help yourself.
No wonder you keep failing your first year's exams, Tony.
Well, only 3 times.
That's what I mean. This is the 4th time you've started the first year.
Yes, I know. It's the life, isn't it? More coffee for you two?
Thanks.
Not for me, thanks.
You don't sound unduly upset.
No, I'm not upset at all. As a matter of fact, I have no intention of passing at all in the foreseeable future.
What? No intention of passing?
No, well, mind you, not a word to anybody at the hospital about this, of course.
No. Oh, sure.
Yeah. You see, I fail my first year each time on purpose. See, with a bit of luck, the end of the year will find me back here starting all over again.
You fail your anatomy on purpose?
Every year. But only just, you see. I mean, one must be careful not to give the game away.
Well, I suppose it must be as difficult to fail an examination skillfully as to pass it.
Well, it's a damn sight more so. I mean, to give the impression of, once again, just having been unfortunate in the choice of questions, you know.
Oh, yes, but why? I mean, it was difficult enough getting admitted. Why on earth would you wish to fail year after year?
Ah, Granny.
Come again?
Granny, my paternal grandmother. A well-to-do octogenarian who passed the long, drawn-out twilight of her life in Ilfracombe.
But she's the reason you failed your anatomy 3 times on the trot.
Indeed she is. God rest her lovely woolen bloomers.
Well, how come?
Well, you see, as she had nothing else to occupy her during her retirement in swinging Ilfracombe, she developed a wide selection of complaints.
Well, thing.
No, she loved it, you see. It became a career with her. However, these complaints, all imaginary, were smoothed away in good time by the expensive attentions of her charming physicians. You see, while sitting up in bed with a cup of beef tea in one hand and a thermometer in the other, her regard for the medical profession mounted with each indisposition. Would either of you lads like a cigarette?
No, thanks.
Oh, no, thanks. Sorry, good, cheap round. Now, where was I?
Granny was happily in bed under several physicians.
Yeah. Yes. You see, her regard for the doctors increased. So did her disappointment that she could not number a single member of that splendid profession among her own family. The only person who could rectify the omission was yours truly, young Anthony Spencer Benskin. So, while I was still at school, Granny conceived the idea of enticing me into the profession by offering to pay my expenses for the course.
Whoa, lucky old you, boy.
Oh, yes, indeed. Now, unfortunately, Granny, shortly after this splendiferous gesture, developed a non-imaginary malady, which, not surprisingly, was beyond the capabilities of her doctors.
She died, did she?
She kicked the veritable bucket.
Oh, dear.
Oh, you were beginning to get fond of the old girl, were you?
Yeah, I was rather, yes.
Yeah, so you didn't get your medical course paid for?
Patience, my good Taffy. Granny's will contained a clause.
Ah.
She bequeathed Anthony Spencer Benskin the sum of £2,000 a year during the time he was a medical student.
What, you jammy blighter?
Now, I did not immediately realize the full significance of this. I was in the middle of my first year's study, the first time round, when it suddenly dawned on me.
What did?
2,000 a year, during the time I was a medical student. You see, I had the most glorious opportunity of receiving a most generous allowance without the tedium of doing any work for the rest of my life.
You mean that's why you fail your exams?
I take great pains, old boy.
And on a 6-year course, you've already managed to go 3 years on the first year.
That's it, yes.
So even if you pass this year...
Don't even think of it. Shush.
No. Right. But, I mean, if you do pass, that's 4 years to get through the first year. But at that rate, it would take you 24 years to complete the course.
That's it, yes. Mind you, I'll try to make it last longer.
At 2,000 quid a year.
It's super, isn't it?
As a matter of interest, how long will Granny's money sustain this?
Oh, you see, it's in a trust fund. My solicitor reckons I could stay here until I'm 71.
Bells.
Yeah. I mean, there we are, you see. Whichever government is making a mess of things, it makes no difference to yours truly. I pay my fees promptly, attend sufficient classes in the hospital, and I behave myself, which is sufficient for St. Swithins. I have this flat, a large number of very good friends, and a 1937 Bentley known as the Ulcer.
The Ulcer?
Yes, it's always blowing up.
Oh.
I have discovered the secret of successful living.
Well, I must say I wish Father had sent my grandmother to Ilfracombe.
Good morning, boys.
On top of all that, you've got Vera. Can't be bad, can it?
Morning, Vera.
Good morning, David.
David, darling, he is Taffy, my love.
Oh, you English and your flaming nicknames. We foreigners will stick together, Vera.
Hello, Simon. I've seen you already this morning, haven't I?
Yes, in the loofah. In the bathroom.
Yes, you'll have to watch Vera. She doesn't care, you know. You'll just have to learn to cover your embarrassment, Simon.
It's not my embarrassment I'm worried about.
Oh, well, come on, Simon. You and me have got to get down to St. Swithins. Even if Tony doesn't care about the anatomy course, I do.
But we're not late, Taff.
I don't think so. Well, Professor Lewis hasn't turned up yet.
No.
Well, shall we wander over and have a look then, Simon?
Well, at the bodies? Yes, if you want to. I didn't realize we'd be set to work on dead bodies our first day, did you?
Oh, well, I didn't think, really.
Oh. Golly, look. Dead bodies.
Aye. Pretty gruesome they look, I must say.
Yeah. They've got no clothes on either.
Well, did you expect them to have?
No. Don't look at all well, do they?
Well, mind you, they're all getting on a bit.
Not anymore, they're not.
Oh, now, where are we?
Look, what's in that corner over there?
Where?
Here, in these specimen jars. They've got labels on them. Ugh.
Oh, what a horrible sight.
Liver. F. Bidley, 1906. Blimey, Mr. Bidley's liver looks like a hobnail boot.
Yeah. Enlarged toe. J.R. Tompkins, 1920.
Good heavens.
Ruptured spleen, vermiform appendix. There's rows and rows of them. Can I interest you in a pickled kidney?
Please. So, one way of being remembered, I suppose. Giving a bit of yourself to the pathologist.
I suppose so.
Bit better than a tombstone.
Aye.
Cheaper, too.
Hey, look at that one.
Take your filthy hands off that specimen jar. Silence, everybody. Silence, you horrible man at the end there. You, sir, Cockgrove. Put down that withered, contracted terminal part of the human arm and listen.
What's the Lancelot Spratt doing here?
You want to ask me?
Silence, you two. What's your name, you boy?
Oh, Evans, sir.
Oh, yes, Evans, the comedy Welshman. You are Welsh, aren't you?
Yes, sir.
Yes, well, I'll try not to hold it against you. Quiet! Now, who's the youth next to the comedy Welshman? The one interfering with the specimens?
Me, sir?
You, sir, what's your appellation?
Church of England, sir.
Your name is... Don't you understand plain English?
Sparrow, sir. Simon.
Oh, of course, Sparrow. Yes, the comedy Sparrow. Right, now then. Some of you have met me before. However, for the uninitiated, I am Sir Lancelot Spratt, the last of the great general surgeons and a law unto myself. You lot in front here, Evan, Sparrow, the rest of the rabble. Oh, begging your pardon, madam. Well, what's your name?
Chapman. Linda Chapman.
Oh, enchanté de faire votre connaissance, mademoiselle. Charmed. Wipe that grin off your face, Sparrow. You'll end up in one of those jars with a label around your neck. Stop cackling, blast you. This is a medical school, not a damn chicken farm. Right, now, pay attention, all of you, particularly Evans and Sparrow. Sadly, the anatomy professor, Professor Lewis, has been struck down.
Sunday driver?
Yeah, not by a motor vehicle, but by something equally unpleasant, a type of virus. This miserable virus will render the professor immobile for at least 3 weeks. So, until further notice, the anatomy class will be under my jurisdiction. However, I have far more important work to do than walk up and down watching you donkeys making asses of yourselves. Cotgrove and the rest of the senior lot up there, got enough dissecting to keep you occupied for the rest of the day? Get on with it then, quickly and silently. Now, you lot in front here. You new, shiny lot. Now, gather round. I shall address you briefly, depart, and return later. Come on, spread yourselves out, stand back. I don't want you breathing down my neck. Now, get yourselves round these 4 tables, split up into 4 groups, so that each group has its own departed body, naked and ready for your attention. That's right. Evans, Sparrow, this table by me when I can see you. Do you have your canvas roll containing forceps, freshly sharpened scalpel, wire probe?
Oh.
And you, Evans Sparrow?
Yes, sir. All present, Grace, sir.
Right. Now, listen to me carefully. You've got to work in this department. You've got to work in every department of St. Swithin's for the next 6 years, but in the dissecting room you have to work. And I don't want to see any of you men slopping around with your hands in your pockets, do I, Sparrow?
No, sir.
Now, what does it give you, Sparrow?
Baggy trousers, sir.
Yep. It gives you osteoarthritis.
Yes, sir.
Yes.
Yes.
In other words, you'll end up looking like the hunchback of Notre Dame. Now then, you will work in pairs. During the first term, you will dissect the various organs and parts of the body. The list of the parts for dissection is up on the board here, together with a list telling you who your partner will be for the next term. Sparrow, Evans, you two will dissect together.
Splendid, sir. Thank you.
It is not for your benefit, Sparrow. It is to ensure that you do not corrupt anyone else in the class. I prefer to have all my rotten eggs in one basket. Your dissecting manuals, your Bibles. Take them round, Adams, one to each pair. I shall return anon to see what ghastly mess you've made of these poor souls here. Come on, everybody, take your partners.
For the first walk of the morning.
Sparrow, we've got each other for 6 long years. It's going to be a long and bloody battle.
Crumbs, Taff. 6 years of that.
He's flipping well got it in for us.
He's certainly... Well, anyway, not to worry. Let's have a look at that list. See who we've got given to dissect.
Table number 2.
Sounds like a Savoy grill, doesn't it? Come on, let's see what's on the menu. Table number 2. Here we are now. What's it say? Week 1, dissect both legs. Week 2, dissect both arms. Week 3, dissect head. I feel weak already. Here we are. Table number 2.
Well, quite a healthy-looking specimen, all things considered.
Yeah. Morning's up. No answer with a stern reply.
Well, what do we do first?
Well, now look, put your tools on the table.
Right.
And we rest the manual on his stomach. Now, careful. That's it. Now, what's the little book say about dissecting the leg?
Here, now, hang on, boy.
Mm-hmm.
What are those red lines on that diagram there?
Let's check at the back of the manual. Arteries or veins or muscles?
Oh, arteries, I should imagine.
Yeah, you're right. You're right.
So that seems to be our skin incision there.
Don't poke him with your finger.
Oh, sorry.
Bit of respect. You should use your wire probe.
All right, sir.
Provided.
Will you start cutting or will I?
No, please, after you. Go on, go ahead.
Ta. Scalpel. That's the thing, isn't it?
Yes, yes.
Ah, well. Well, here goes.
Well, careful. We're dissecting it, not amputating it. That's better. No, whoa, hang on a second.
What?
I think you've cut the wrong thing.
Oh, hell's bells.
Well, I'm not sure, mind you.
Well, let me have a look at that book. There's
Here
a
you
picture there, isn't there?
Yeah, here you are. Yeah, you see, what you've done there doesn't look quite like what the picture says, does it?
No.
No.
No, not quite, does it?
No. Look, shall we forget this leg and start on the other one,
Good morning. Is there a doctor in the house? I see. Relax, everyone. Fanny Spratt's up to his eyes in gore in the theatre. Won't be over before lunch. Hello, Simon, old love. Taff. I had a few holes of golf. Was on my way back to the flat, so thought I'd pop in and see how you were getting on.
Not bad, you know.
Bit of a shock to discover that Fanny Spratt's to take over from the professor, huh?
Only for a few weeks.
That's long enough, old lad, I promise you. Now, how are you two progressing? Let's have a look. Ooh, yuck.
Oh.
You've made a bit of a mess of that, haven't you? What are you using, hammer and chisel?
Oh, look, come off it. It's only our first day, you know.
Sensitive taffy, yes. Look, you see, you should have exposed the nerve before you cut away the tendons.
It's not easy.
Well, it's damn difficult.
I think the trouble is we're not quite sure where to start.
Then let me assist you, dear boy. Give us your scalpel, Taff.
Here you are.
Scalpel poised, nothing up my sleeves. I have already dissected 4 legs, and I consider I have something of a flair for the knife. Now, this is the gluteus maximus muscle, and with a dexterous twist of me powerful wrist...
It's been a long, hard term. It's been a very long, hard term. For me. For the majority of you horrible, nasty young men, it has been a term of non-stop debauchery. Ah, Mr. Benskin, how nice to see you here today. This is indeed an honor.
Morning, Sir Lancelot.
Good morning to you, Benskin. And where have you been recently?
Oh, I've been here, sir. I've been attending lectures, studying.
You've been here, have you? So what disguise have you been wearing? What are you giggling at, Sparrow?
Giggling, sir?
Good grief, boy, don't you understand plain English? Most appropriate for you, Sparrow. The Oxford Dictionary describes giggling as laughing like an affected, ill-bred or undisciplined girl.
I honestly don't think I'm undisciplined, Sir Lancelot.
You're useless. And you stand about as much chance of passing your anatomy exams as a snowball in hell.
Well, I feel I'm in there with a bit of a chance, sir.
You have to cram like mad these next 2 weeks to even understand the damn questions. You are the perfect example, Evans, of how a young man's studies can be affected by booze and sex. Is that not so, Sparrow?
Well, I really wouldn't know, sir. But if he passes, it's a marvellous advert for them.
Now, the point I'm trying to make to you miserable would-be doctors, including you, Benskin, who will probably have been 97 before you graduate,
Flatterer.
is that this is a serious business. I don't give a damn what you do if it doesn't interfere with your studies. But the way most of you carry on makes the Kama Sutra seem like Noddy in Toyland. In a fortnight's time, you will undergo a rigorous test of what you've learnt in the past 12 months. What's that called on which you're sitting, Sparrow?
A wooden bench, sir.
Yeah. What bones go to make up your backside, you silly fool?
Oh, yes, sorry. I have my coccyx.
I'm very pleased to hear that.
My pelvis bones.
Yes.
And, would I have a sacrum?
You'd damn well collapse if you hadn't. Describe the sacrum, Sparrow.
Describe it? Well, isn't it enough that I know I've got one, sir?
Describe it.
Yes, sir. Well, of course, I've never seen my own, sir, because, I'm usually sitting on it. It's at the bottom of the column.
Whose column, Nelson's?
No, sir, of course, no, the spinal column. It's composed of 5 rudimentary vertebrae, which make it a rather large joint. I mean, when I say joint, sir, I don't mean the cut off the joint.
I know what you mean. Get on with it.
Well, that's all, really, sir. It's, jolly useful to have the old sacrum, really.
I see. And is the sacrum related to the coccyx?
Ooh, only distantly, I would say.
They're joined together, Sparrow.
Well, that's what I meant, sir. Joined together.
And what infections or diseases manifest themselves thereabout?
Lumbago, sciatica, and, yes, funny livers.
Funny livers?
Yes, when I say funny livers...
All right. Now, what is the weight of the average liver?
Well, I know it's the largest,
Gland?
That's it, sir. Well done, sir.
Thank you, sir.
The largest gland. Actually, very interesting, sir. One of the most surprising things, yes. The average liver weighs 13 pounds.
13 pounds.
Yes, sir.
And from whom did you learn that, Sparrow?
Professor Lewis, sir.
And the professor showed you a liver weighing 13 pounds?
Yes, sir.
Did he also show you the horse that went with it? The human liver weighs approximately 3.5 pounds. Great Scott, you lot have got some work ahead of you and everything.
Here is your coffee, boys.
Oh, thanks, Vera.
Johnny not off yet?
Oh, yes, he left the flat at 8 o'clock.
On a Saturday morning?
Yes, I know. He had no breakfast, simply shaved and dressed and hurried out. Said he'd be about an hour.
That's funny. Shall I take your plate, Simon?
Yes, thank you. That was fabulous, Vera. Terrific. You certainly can cook.
Simon, it was only a boiled egg.
Was it? Oh, yes, I mean, boiled to perfection. What do you think he's after, Vera?
I don't know, but I'm dead broke, I can tell you that.
Honestly, a little compliment. You both accuse me of ulterior motives. Just because you Welsh are ignorant clods.
Yes.
Well, it doesn't mean to say that I'm one.
Well, we'll see who's the ignorant clod when the anatomy and physiology results come through, won't we, boyo?
Oh, good. We'll know on Monday, won't we? A weekend of agony.
You will pass, both of you.
Taffy might.
Oh, of course you will, Simon. You're very brainy.
Yes, but Vera, we crammed everything this last couple of weeks. I know the time suits are just fly.
Well, it can't be easy for you two trying to study when Anthony only sits back and enjoys life.
Yeah, I must say he's got it taped, though. Bowls into a couple of lectures a month. Spends his time with the horses or the dogs.
Or the pub.
It's all a bit cockeyed. I mean, how long can he go on? This is his 4th year already, and he still hasn't passed anything.
I suppose he can last out as long as he gets the 2,000 quid a year from his grandmother's will.
I must say it seems daft to me.
Tony thinks it's a life. What do you think, Vera?
Oh, it isn't my decision, if this is what Anthony wants. You know, I sometimes think he underestimates himself. I sometimes think he could achieve many things with his energy, enthusiasm, and he's highly intelligent, you know. A very good brain.
Yes.
Yes. It's pity he's such a pig.
Ah, she's a smashing girl, you know.
Ah, she is that.
Benskin doesn't know how jolly lucky he is.
Still, what about those dreadful rows they have?
Yeah, I know, but have a marvellous time making them up, don't they?
Hello, lads.
Tony, where have you been?
Over to Swithin's.
What, on a Saturday morning?
It's difficult enough to get you into the hospital any day of the week, let alone Saturday.
I thought I'd do you two a favour.
Favour?
Right.
Yes, I thought you'd like to know how the pair of you did in the anatomy and physiology examinations.
Oh, boy, would we.
But the results won't be on the board until Monday, will they?
No, but Jock can fix that.
Look, how can the school porter fix it?
You see, the results always arrive by post on the Saturday and get left on the dean's desk until Monday morning. Jock and I steam the envelope open and save everybody a weekend of agony.
Bells, that's decent of you.
Yes, it is, isn't it? Well, as a matter of fact, you see, there's usually very heavy betting on the exam results, and it's very handy to know the outcome while the book's still open, you see.
That's what you've been doing this morning, opening the envelope in which...
In which are the results of last week's anatomy and physiology papers, yes.
You mean, you know the names of all those fortunate students who have passed?
That's it.
And you know the names of the students who haven't passed?
That's it.
And you know...
Oh, belt up, Simon. Well, come on, Tony boy. Oh, did Simon and me scrape through?
No.
What?
No.
Well, didn't we scrape through?
No.
Oh, flipping heck.
You didn't scrape through. You came through with flying colours.
Oh, you beast, Benskin.
Gosh, you might have given us both half failure. We're through. Do you realise that, Taff? We're through. Only another 5 years and 23 exams to go. We're through. We've done it.
Oh, it's a marvellous feeling, isn't it?
Marvellous. It's better than crumpet.
Yeah.
Well, how would you know?
Yeah, what's all the noise about?
Vera, me and Simon have passed the anatomy and physiology.
No.
We did. We're through. We've done it. I feel like a man who's been left £1 million. I'm better than him, in fact. Here, Taff, we're released. Do you realise that? Released from all those dead stiffs in the dissecting room. From Monday, we'll be with the living, dying in the wards.
Yippee!
Oh, he's gone raving bonkers.
Thank heaven we only worked in the last 2 weeks. Oh. Taff.
Aye?
We can start to wander around the hospital, acting like real doctors. I could buy myself a short white coat and a long black stethoscope.
Oh, it's a miracle. There's no doubt about that. My old man said before I left home I'd never make it. You'll be back here on the farm within 12 months, he said. And as much as I love him, I'm going to write to him today and I'm going to tell him he can stuff his farm right up his Cardiganshire.
Honestly, it's fantastic. Yeah. You look pretty rotten, Tony.
Yeah, do I?
Aye, you do look a bit grim, boy.
There's nothing wrong, is there, Anthony?
No, only the exam.
The exam?
Of course. I'm sorry, Tony. Here's me jumping for joy because we passed and forgetting that you failed again.
But that's the object of the exercise, isn't it, Tony, to fail?
Yes.
Well, you must be used to failing after all these years, then.
Yes, I am.
Well, what's up, then?
I'm not used to passing.
You passed?
Yes.
Tony, I'm most terribly sorry.
Pass?
Yes, I know. I can't think where the devil I slipped up.
Won't affect your granny's money, will it?
Oh, no fear. I get that right up until I qualify.
Well, cheer up. You've got 23 examinations. You can fail before then.
Yes, I've obviously got a lot of hard work ahead of me.
Oh, don't look so miserable. The 3 of us will be together.
Of course.
Oh, well, come on, let's celebrate. Let's have a celebration.
Right. I'll put the kettle on.
Yeah.
In that episode of Doctor in the House, written by Ray Cooney, the parts were played as follows. Simon Sparrow, Richard Briers, Sir Lancelot Spratt, Geoffrey Sumner, Tony Benskin, Ray Cooney, Taffy Evans, Edward Cast, Vera, Norma, Ronald. Doctor in the House was produced by David Hatch. we present Doctor in the House. Adapted for radio by Ray Cooney from the original novel by Richard Gordon, it stars Richard Briers as Simon Sparrow and Geoffrey Sumner as Sir Lancelot Spratt. And this week's special guest, Irene Handel as Mrs. Clark. Episode 4, In the Wards.
Which tie do you think I should wear, Taff?
Well, as long as it's not as strong as your aftershave lotion, it doesn't matter, does it?
Of course it matters. We're second-year students now, not just one of the rabble. Today we go into the wards for the first time. From today, we're somebody. You fling over that clothes brush, will you?
So you have to wear a flipping suit, do you?
Of course.
Well, I haven't got a suit.
Shouldn't spend all your cash on women and booze, should you?
This jacket and corduroy trousers has seen me through my first year at Swithin's. They can flipping well see me through my second. I can just about see the seat of the flipping trousers as well.
What time does Collinson's open?
Collinson?
The surgical instrument makers. We're allowed to sport a stethoscope from now on, you know.
Oh, you're not buying a brand new one, are you, Simon?
You bet. It's symbolic of our new status. I've been saving up for a year.
Oh, to hell with a new one, though. I'm getting one from the pawn shop round the corner.
I've seen a real beauty in Collinson's.
When I walk through the hospital with that dangly around my neck, they think I'm the Queen's physician.
Well, how much is it?
12 quid, I think.
12 quid? Well, what is it, a convertible?
It's absolutely marvellous.
Well, it'd have to be. Blimey, it's only for listening through.
I tell you, this one is so sensitive it practically diagnoses and cures as well. And it's got a chest piece as big as a jam pop cover.
Good morning, good morning, good morning.
All right, Tony.
Had breakfast?
Yes, thanks.
I say, Simon, you pong a bit, don't you?
It's my aftershave.
Oh, is that what it is? You're all dolled up, too. I say, nobody died, have they?
It's our first day in the wards, remember?
Well, so what? That's no reason to dress up and smother yourself in old flower water.
He's treated himself to a brand new stethoscope as well.
He's gone stark staring mad. Wait a minute, I get it. You're out to impress the dollies, aren't you?
Impress the dollies?
Yes, the female patients.
You fancy yourself, don't you, young Sparrow, walking through the female patient ward looking like Dr. Finlay?
Nothing of the sort. I'm not doing it for the female patients at all.
They're more fool you, old love. Actually, some of these young patients are absolutely gorgeous.
Oh, tell us more, Boyle.
And very cooperative, too. Oh, well, it stands to reason, doesn't it? I mean, if there's nothing seriously wrong with them and they're stuck in bed for weeks on end, they, they tend to get lonely and, they're missing a bit of the old,
Yes, we know.
But not that I'm thinking of myself. I mean, I've got my lovely Vera, but you two should have a fabulous time.
Well, no wonder Simon's so keen to look smart and dangle his jam pot cover.
Dangle his what?
Look, it's got nothing to do with it at all. Anyway, that sort of thing, fraternizing with the patients, is strictly against the Hippocratic Oath.
Well, we don't have to take that until we qualify.
Yeah, we're still bound by it, though, aren't we?
Well, you may be, but I can't wait to get at a smashing piece with a dodgy chest.
Simon, it is what is known as student's perks, old love.
Well, quite frankly, I prefer to keep my love life out of the hospital.
What love life?
Well, my...
You don't even know the difference between the sexes.
What do you mean?
Now, don't be nasty to Simon Taffy. He's taking his time.
Well, hell's bells, or whatever job you're in, it's only fair to take advantage of the advantages. And if some nice blonde patient gives me the eye, I'll give her just what the doctor ordered.
Well, that's up to you then, isn't it?
You're dead scared, boy. Why don't you admit it?
Rubbish.
Yes, you are. You think the only difference between men and women is the length of their hair.
Oh, do I?
Yes.
Well, you must admit it's not easy telling the difference just by the length of their hair.
Hey, Tony, why don't you get Vera to fix him up with one of her chums?
Look, I don't want to be fixed up.
Of course you do.
Hey, what about the girl Vera brought round for supper the other evening?
Oh, Pamela. Oh, she was great, boyo. Well, didn't you think she was great, Simon?
She was all right.
Oh, I thought she was great.
Look, we could tell that, Taff, gaping at her as though she was a flipping Christmas cake.
Oh, she was ravishing.
Actually, Simon, old love, I must say she seemed extremely taken by you.
No, she wasn't.
Look, let's invite this Pamela round again and arrange a...
Look, I do all right.
Oh, yes, you certainly live it up. Since we've been at St. Swithin's, you've taken one probationary nurse to the pictures and an art student for a round trip on the underground.
We're not all sex maniacs, you know.
We are, you know.
Now, this bird, Pamela, she had the biggest bristles I've ever seen.
Bristles?
Well, it's one of Tony's, rhyming slang. Bristles.
What the devil does Bristol's rhyme with?
No, look, you see, Simon, what it is that Bristol's has been abbreviated from Bristol City.
Well, what does Bristol City rhyme with? Yes, I've got it.
She was lovely, though, wasn't she? Talk about top-heavy. Pam the chest, we'll call her.
Charming. Look, I'll have a word with Vera and get her to fix you up, Simon.
Look, I don't want to be fixed up with Pam the chest, thank you.
You don't?
No, I don't.
Well, she's lovely, gorgeous.
Is she? Well, don't be so coarse about her, then.
Well, gorgeous isn't coarse.
No, but Bristol's is.
Look, Simon, don't get so het up, old lad.
Well, how would you like it, Tony, if someone spoke about your sister like that?
Well, I wouldn't mind at all, actually.
No?
No, I haven't got a sister.
Oh. Witty. Well, you've got a mother, haven't you?
Of course I have, and she'd be absolutely tickled pink if someone said she's got a lovely pair of...
Oh, shut up. Well, I'm sorry, but I think it's coarse. Women ought to be treated with respect. I don't care if you do consider that it'd be old-fashioned. They like to be treated with respect, Taffy. Anyway, quite frankly, I'm more interested in my new stethoscope at the moment. I want to buy that before our first lecture today. Here, who are you with, by the way?
Dr. Maxworth first, and then we meet the dreadful Sister Virtue, of whom it has been said, hell hath no fury like a woman's corns. I say.
There are 2 medical wards in the hospital. One for males, one for females. The male ward is called Patience. The female ward is called Virtue. I am Sister Virtue. Why do you smile, Mr. Sparrow?
Nothing, sister.
You students will be given half a dozen beds to look after, and you're obliged to examine the patients admitted to them, take notes on their progression, and write an account of the case on the consultant's weekly list. Through those swing doors there is my ward, the women's ward, Virtue ward.
Virtue won't hurt you, but vice is nice.
My office is outside here through that door.
The one marked Sister Virtue, knock and wait.
Correct, Mr. Benskin. Teaching will be done at the patient's bedside, either by Dr. Maxworth himself, by his junior consultant, the registrar, or the houseman. Any questions?
No, sister, none at all. Thank you, no, sister.
You're expected to educate yourselves in the intervals by nosing round the wards for instructive signs and symptoms, seeing to the unending medical chores, and doing exactly as you are told. Wait here, all of you. I'm going into my office to get you your instruction sheets.
Sure. Well, here we go, then.
Look like new prisoners being admitted to Dartmoor.
What about Sister Virtue? I think she's got the most belligerent bosom I've ever seen.
Yeah. And being close to her is rather like being in a rowing boat under the bows of the Queen Elizabeth.
What's known as a fine figure of a woman?
I can say that again. And what about that bottom of hers?
Yes. I reckon that's off the Queen Elizabeth, too. Yeah.
Now, look here, we're being very unkind.
Oh, yes, we are.
We are. But she can't help having a face like the side of a quarry.
Still, it's a bit of luck us getting on a female ward, though, eh? All those lovely little patients waiting for us to give them a going over.
Don't you ever think about anything else?
Well, what else is there?
I must say, Simon, I admire your stethoscope enormously.
Thanks, Tony. It's certainly the biggest on view.
Oh, I don't know. Look at the one I picked up from the pawn shop. £4.10.
Let's have a look. Mine's bigger.
Well, you wouldn't say that.
Well, mine's certainly the best.
What is the object of this dubious conversation, Sparrow?
Oh, Sir Lancelot, good morning, sir. We were discussing my stethoscope.
Oh, were you? Well, that's a relief. Well, let's have a look, then. Sure. What is it, a mine detector?
It cost £12, sir, from Collinson's.
Oh, did it? Well, it's ostentatious in the extreme, Sparrow. Your first day in the wards, isn't it?
Yes, Sir Lancelot. We're waiting for Sister Virtue to take us round.
Ah, so you've been given a female ward, have you? Oh, jammy lot.
Yes, sir.
So that explains the smart suit, Sparrow, and the sprawnciest stethoscope, you nasty, sensual beast.
I beg your pardon, sir.
Can't wait to get your filthy hands on the patients, can you?
I won't lay a filthy finger on them, sir. I mean,
I know. You'll have that stethoscope all over them.
Look, sir, my stethoscope knows its place.
Oh, just...
It does indeed, sir, and so do I. I'll listen to...
Yes?
And I won't touch any...
Any what?
Bristles, channels.
What is he talking about, Benskin?
I haven't got the faintest idea, sir.
Now, listen to me, all of you. If I hear that any of you has been interfering with the female patients, I'll have you in front of the dean faster than you can say streptococci. Is that clear?
Yes, sir. Yes, sir.
Evans, is that clear?
Oh, of course, sir. I mean, well, it's against the Hippocratic Oath, isn't it, sir?
Good morning, Sir Lancelot.
Ah, sister, good morning. I've just been telling this odious rabble that you will not tolerate any misbehavior with the female patients.
What? Certainly not. nor my nurses. That sort of thing I'll squash immediately.
Yes, you sit on it, sister. You stamp on it. That's the one to watch, sister, the beady-eyed Sparrow. The blatant way he's wearing his stethoscope is a warning of his evil intentions. And if I hear you've been misbehaving, Sparrow, I'll have your guts for stitches. Good morning, sister.
Pay attention. Here are your instruction sheets. You are only allowed in the wards between 10 a.m. and noon, and from 2 p.m. until 6 p.m. Understood?
Yes, sister. Yes, sister.
You may look at patients number 5, 8, 12, 20, 27, and 37.
Bingo!
You will replace the bedclothes neatly, and you will always ask the staff nurse for a chaperone before examining any female patient below the head and neck. Mr. Sparrow?
Yes, sister?
Remember, a chaperone. Kindly remember also that I do not like students in my ward at all, but we are forced to put up with you. Now, before letting you loose on those unsuspecting females through there are several things I wish to tell you. When examining a patient, whatever part of the patient you're examining, Mr. Sparrow, the golden rule is inspection, palpation, percussion, osculation. Do you understand, Mr. Sparrow?
Inspection, palpation, percussion. What was the last one, please, sister?
Osculation.
Ah, yes. No, I don't understand.
Inspection, examine the patient. Palpation, handle the patient. Percussion,
Strike the patient.
tap the patient. Osculation, listen to the patient.
Here.
Whatever disease you suspect, the 4 motions must be gone through in that order. You look first, then feel.
Oh, lovely.
When you have felt, you may tap, but not before. And last of all comes the stethoscope. Although we're far too busy here, the staff will combine to teach you to feel lumps and livers and spleens, how to understand the evasive murmurs transmitted through a stethoscope, and how to percuss correctly. Diagnosis is simple observation and applied logic. Do you understand, Evans?
Oh, yes, sister. Sort of police work.
Exactly. A matter of searching for clues, igniting a suspicion, and knowing where to look for proof. Sparrow?
Yes, sister?
When I finally get to my bed at night, do you know who I take with me?
I really can't begin to imagine, sister.
Sir Arthur Conan Doyle.
Oh, is he one of the Oh, Conan Doyle!
Yes, I find his Sherlock Holmes fascinating. Conan Doyle modelled Mr. Holmes on a physician, and the reverse holds perfectly well. Now, this is the treatment book. Every bodily occurrence that can be measured will be measured and entered.
Charming.
So, make sure that the treatment book is accurately kept and up to date. The same applies to the temperature charts which hang from the foot of the beds. This last book here is very important. You will be sent round the ward every evening to ask how many times in the past 24 hours each inmate has performed. Do you understand, Mr. Sparrow?
Yes, I think so, sister.
Mr. Benskin?
Oh, yes, sister. We just ask how many for the book.
Yes. The patients very soon catch the spirit of the thing.
Sounds quite jolly, really, sister. Make a very good panel game, actually.
We've discovered that the light-hearted approach to the matter is the most successful way of obtaining the information. You will find that those patients returning fair scores do so with a proud ring in their voice.
I suppose anyone returning a duck has to go back to square one and start again.
This is serious, Mr. Sparrow.
Oh, sorry, sister. Of course, I realise that.
A naught I regard as unfortunate. 2 successive naughts unpleasant. And more than 2 blank days I take to be a personal insult. That's all then. Don't make any unnecessary noise in the ward. And I repeat, do as you are told. In you go to the ward then.
Aren't you coming with us, sister?
Oh, I'm far too busy, Mr. Sparrow. I have all my office work as well. You have your instruction sheets and you know the patients you may examine. And remember what I said about a chaperone, Mr. Sparrow.
She arrives here every morning on a broomstick.
There's a devil of a lot of do's and don'ts on this instruction sheet. A careful history must be taken before the patient is examined.
Well, the questions we have to ask don't seem too difficult. Name, address, age, sex, occupation. Does he or she like it? That apply to occupation or sex?
Marital state, if married, how long?
Come on in, let's get cracking. I can't wait to try my luck on a real patient.
In we go then, once more into the breach, dear friends, and close the wall up with our Swithins dead.
Now. Good morning, madam. My name is Sparrow.
Aye?
Good morning. My name is Sparrow.
Oh, my God. Can't you lot leave us alone?
Fed up with the medical profession, are we?
Not half. Testing, darting, poking, probbing. No, fizzing doctors.
I beg your pardon?
Frizzing doctors.
Well, I'm not actually a doctor, madam.
Yeah? At least you got the decency to admit it.
May I look at your temperature chart?
Help yourself.
Thanks so much.
Where are you, then, if you're not a doctor?
Second-year student.
Oh, God, help us all. I've had some of you lot before.
Yes, I can imagine.
Yeah, a Boy Scout with a first aid certificate. Be more use.
Yes, you're probably right. Now, look, do you mind if I ask you a few questions?
Yes.
Oh, please. I'd be most grateful.
Oh, all right, then. Let me put my teeth in first. And a sack glass. Frizzing hospital, this is. Only way I'll get out is feet first.
Oh, now your case doesn't appear to be as serious as all that.
I know, that's what worries me.
Now, name, please.
Rosina Alfreda Harriet Clark.
Rosina Alfreda Harriet Clark.
With a E. Clark, with a E.
Oh, yes, of course. Address?
56 Jeffreys Road, Kentish Town. They've got all this.
Yeah, but it's most important.
Well, what do they want it again for?
I haven't the faintest idea.
Frizzing Ministry of Health.
Now, Kentish Town, that's north something, isn't it?
North 7.
North 7, fine. Age?
21.
21. Now, marital state?
Frizzing awful.
Shall I put that down?
Please yourself.
Perhaps I'd better simply say yes. It is yes, isn't it?
Yes, it's a yes. You want his name? I've got a few for him, I can tell you.
No, thanks, no. Occupation?
Frizzing layabout.
No, your occupation.
Oh, office cleaner.
Office cleaner. Splendid. Right, then, now, what seems to be your trouble, Mrs. Clark?
Getting out of this frizzing hospital, son.
Well, what I'm trying to get at is why you were brought in.
So that it could all have a damn good go at poking and probbing me. Something to do with me intestines.
Oh, yes, I see, yes.
My doctor on the panel sent me to see this specialist bloke. He said me insides was wonky.
Wonky?
Ah, load of rubbish. I've had them for donkey's years. They haven't blown up yet.
Look, now, what treatment are they giving you in St. Swithins?
None, I don't think. They're just poking and probbing. Don't know what they're doing half the time. As for that frizzing Sister Virtue...
Yes, quite, I admit her.
Oh, have you? Then in future you want to avoid her like a pile of uranium.
Well, I mean, I'm sure she's not as bad as all that.
She's worse. She should have been a policeman. Anyway, I put one across her now. She's in a proper 2 and 8 about me.
How's that?
That frizzing chart of hers.
Yes?
She's never known anything like it. I've got 5 blanks against my name so far.
5?
Yes, they tried everything. I've still produced sweet Fanny Adams.
I beg your pardon, madam.
Oh, here he is, the pick of the bunch.
Now, please, Mrs. Clark, this is Sir Lancelot Fanny. Adams. Spratt. Sir Lancelot Spratt.
I know who he is.
Good.
Biggest butcher of the lot.
Please, now, Mrs. Clark, that's no way to speak about Sir Lancelot. He's one of the gentlemen who'll make you well again.
Yes, I've heard all about him. He'll have my intestines out before I know what's hit me.
Oh, come along. Turn over, madam.
Beg your pardon?
Turn over on your front side.
What for?
Well, he probably wants to see your back.
Sparrow! I have to give you an injection, madam.
What? What, in me?
Yes.
You and who else?
Turn over, madam.
Not on your Auntie Nellie.
Here, come on, Sparrow, get her over.
Shall I see if there's a hand in nurse?
Get her over.
You lay a finger on me, boy, I'll give you a fortney one.
Up to Daisy, Mrs. Clark.
I'll do the lot of you.
Mrs. Clark, please.
And I'll do you.
Get over, woman.
Stop it, you frizzing butcher.
Benskin.
Oh!
Yes, sir, yes.
Give us a hand, turn Mrs. Clark over.
Turn her over. Why is she done on this side, sir?
Heave. Go on, heave. Heave, water.
Don't you tickle me!
Go on.
There isn't a small crane about his name.
Go on, heave, Sparrow. Come on, Benskin. There we are.
Three of you to do it. You horrible lot.
Now for the injection.
I don't want it.
Up with her nightdress, Sparrow.
You dare.
Me, sir?
You, sir.
Shouldn't we have a chaperone?
You'll need cortisone before I've done with you.
Up with her nightdress, boy. Right. Sorry, Mrs. Clark.
Oh, don't.
Yes, that's it.
Oh!
Now keep still, madam. This is going to hurt you. Damn sight more is going to hurt me. No, that didn't hurt a bit, did it?
Of course you did, you frizzing great nana. You punctured me permanent.
Punctured your what?
There's no mark at all, is there, Sparrow?
Well, as a matter of fact, sir, quite frankly...
Sparrow. You'll be as right as rain, Mrs. Clark, when that takes effect.
Oh, hello, Taffy. How's it going?
Oh, flipping marvellous. What was your first patient like?
Mrs. Clark, frizzing awful. 5 blanks and a punctured bottom. Come again? Forget it. Never mind.
Well, if you're feeling miserable, boyo, try number 27 over there.
Where?
Behind the screen.
What's wrong with her, then?
Oh, nothing at all, boyo, nothing at all.
Well, what's she in for, then?
Well, go over and have a deco.
All right.
Well, I'll have a word with your Mrs. Clark. Good morning, Mrs. Clark. What's your problem, then, love?
Frizzing doctors. Try puncturing my frizzing arm for a change.
Good morning, number 27. My name is... Oh, I say.
Good morning.
I...
Are you another student, darling?
Yes, Yes, I am, actually.
I've just had a colleague of yours.
Have you really?
Taffy Evans, sweet boy.
Yes, oh yes, he's jolly... he's jolly. You're number 27, are you?
That's it. Hang on a second. I'll just put my apple down and Peter Cheney.
Peter... Oh, Cheney, yes.
Get my bed jacket off.
Oh, no, it's all right. No, you don't have to.
And my nightie off my shoulder.
No, there's nothing, honestly. Good heavens. You've got nothing. You're... Oh,
I'm used to the routine.
Oh, jolly good. Look, won't you catch cold like that? I mean, having no nightdress around your...
No, I'm all right.
You certainly are. Look, well, now, I can't think of a thing.
Taffy had plenty of ideas.
I bet. And now, number 27. There are just a few facts about your... What I need is a few details. Look, I really think you might catch cold, you know. Anyway, we must get on with... Your pulse. Yes, I always start with the pulse.
Here we are, then.
Thanks. Now, I'll just find your throbbing radial artery, and, have you any idea where your pulse is? Where? Oh, yes, got it. Thank you.
You're going to listen to my chest, are you?
Probably.
And my tummy?
Probably not your tummy, no.
All the doctors examine my tummy. It's my tummy that's been wrong.
Well, to tell you the truth...
Yes?
I haven't learnt as far as the tummy yet.
I wish you'd look at me when you're talking.
Look? Oh, yes, of course. Good Lord.
You've got lovely hands.
Yes, thank you.
Well, how's my pulse, then? Normal?
I've forgotten that, sorry. Look, I really think you ought to cover up your, you know...
You've got to listen in yet?
No, I don't think I'll listen in. I've seen quite enough. Quite enough to... You tell me what your symptoms are.
You ought to look at my tummy, really.
No, look, you must cover yourself up.
Just have a quick peek.
Look, I'll pull your nightdress just...
What in heaven's name do you think you're doing?
Doing?
Doing.
Nothing, sir.
Nothing, Miss Tregetis, absolutely.
Oh, is this Miss Treget? How do you do?
Sparrow.
Well, I only knew her as number 27. She's on the list.
You were pulling her nightdress off.
I was dressing, Miss...
Dressing? And where is your chaperone?
My... Oh, Crump, I forgot. Shall I get one now?
It's a bit late, isn't it? Cover yourself immediately, Miss Treget.
I'm sorry. It wasn't the doctor's fault.
Mr. Sparrow is not a doctor and probably never will be. Now, cover yourself up, please.
I'm most terribly sorry, sir. I'm most terribly sorry, Miss Treget.
That's all right. Any time.
Over here, Sparrow.
Yes, sir.
Now, Sparrow, what is the meaning of this disgraceful conduct?
Yes, of course, Simon, you're quite right. I mean, it did look dreadful, but the young lady took me unawares. I got very confused, I'm afraid. Being my first day and everything, I was sort of put off, I suppose.
Indeed.
Well, yes, sir, quite frankly, no girl's ever done anything like that in front of me before.
Oh, haven't they?
I mean, it's quite enough to put anybody off their stroke, isn't it? I mean, seeing... what a pair of...
Sparrow! You realise the Dean will probably expel you for this sort of behaviour?
Well, no, I didn't realise it, sir, but I mean, I can see that it might be frowned on. Perhaps I could write a letter of apology to Miss Treget.
It's nothing to do with Miss Treget. She was enjoying every moment of it.
Is anything the matter, Sir Lancelot?
Matter, sister?
I thought you were castigating Mr. Sparrow.
No, it's a damn good idea.
Is there anything the matter, Sir Lancelot?
Is there anything the matter? No, sister, no, nothing at all. Just on my way through the operating theatre, and Sparrow asked me if I could possibly chaperone the number 27 into Sparrow.
No, sir. Yes, sir. Thank you, sir.
Really?
Yes, I was just explaining, sister, I was far too busy. Well, good morning, sister. Morning, Sparrow.
Well, don't stand there, Mr. Sparrow. Go about your business.
Yes, sister.
Hello, Simon.
Oh, hello.
Everything okay?
What? No, it's not. I've just had a shocking rollicking from Fanny Spratt.
What for?
I forgot about that chaperone business.
Oh, that's not serious, surely, is it?
It jolly well is.
Well, which patient?
Number 27.
Oh, you're right, that is serious. Whoa. She's a bit of all right, isn't it? What a figure. Goes out, comes in, and forgets to go back in again.
Have you examined her, then?
Not half, so's Taff. Hello, Taff, how's it going?
I think I've had enough of Mrs. Clark. None of my notes on her will get past the Frisian censor.
You're a fine one, Taff, lumbering me with number 27.
Lumbering?
Yes, Spratt caught Simon at it with her.
No.
Well, how far had you got? Well, you know. Well, no, I don't. Tell me. Well, I was dead scared we were going to go further than Bristol. Oh, lucky old basket. I'm glad you think so.
Well, I've had a lousy couple of patients, one with athlete's foot and one old dear who informs me she's suffering from staphylococcus.
What the devil's that?
Dunno, can't even spell it. Look.
But according to your notes, it looks as though she's got sugar in her cocoa.
Yes.
Are you three gentlemen procrastinating?
No, sister. Definitely not, sister.
I thought you were looking for a chaperone for number 27, Sparrow.
Yes, sister.
Well, take Evans and Benskin and give her a thorough examination.
But we still haven't got a chaperone, sister.
Chaperone each other, boy. Off you go.
Well, if she puts it like that, I suppose we better...
Quite right.
Too true.
Last one there's a sissy.
In that episode of Doctor in the House, written by Ray Cooney, the parts were played as follows. Simon Sparrow, Richard Briers, Sir Lancelot Spratt, Geoffrey Sumner, Tony Benskin, Ray Cooney, Taffy Evans, Edward Cast, Sister Virtue, Joan Sanderson, Girl, Wendy Hall, and this week's special guest, Irene Handel as Mrs. Clark. Doctor in the House was adapted from the original novel by Richard Gordon and produced by David Hatch.